All right, so first up we have Ashley McLeod-Morin. You there?
I'm here.
All right, can everyone see my PDF screen okay?
Yeah. Yes, we can see it.
All right, awesome. The floor is yours, Ashley.
Perfect. Hi, everyone. Thanks, Natalie. I'm excited to actually share the first tiny piece of some data that I'm actually using for my dissertation. I'm a PhD student here at the University of Florida. So that makes me particularly excited to share this information with you guys today. So the title of my poster, a public relations perspective of the COVID-19 pandemic, exploring the organization public relationship indicators of the CDC. Excellent public relations is a really important part of any organization, particularly as they build relationships with their stakeholders, no matter who the stakeholders are for their organization. And this is particularly important when organizations want their stakeholders to follow certain guidance or recommendations. And as we know, this was particularly important throughout the COVID-19 pandemic, and even more important now is we're being presented with more guidance, more recommendations in order to follow. And usually those things happen when there's a strong relationship already there. So I thought it was important to explore that organizational public relationship that the Centers for Disease Control and Prevention has with its stakeholders, which in this circumstance is the general public. So everyone, particularly in the United States for this study. So what I wanted to do, or what I did do, was conduct a quantitative survey that included 1,500 residents in the United States. And I used an instrument that was adapted from Hahn and Grunig's organizational public relations instrument. So they've done a lot of research looking at this and creating indicators for a strong organizational public relationship. I mean, you can go ahead and see those indicators on the right side of the screen there. And so this data was collected between April 23rd and May 7th to give you kind of an idea of where we were in the pandemic there. And today I'm going to present some descriptive data from that study. So as you can see, these are ranked over on the right side of the screen from the highest mean score to the lowest. This was these mean scores are on a 5-point scale. So you can see that trust and satisfaction were reported as the most favorable, with the exchange relationship as the least favorable. And this is particularly important, the exchange relationship, because this is usually an indicator of past relationships with the organization. And so obviously this needs some further exploration to see why that was the case, how this could be improved, things like that. But I think that this is a significant approach that we should be looking at, particularly in science and health organizations, so that these organizations can create stronger relationships with their stakeholders and the public, so that if we're ever faced with a situation like this in the future, we can be more proactive in making sure that people are following the proper recommendations early on. And so I think that these findings could be applied to have more strategic communication efforts in organizations in a broad sense. I also recommend future research to explore how these organizational public relationship indicators might have been impacted throughout the pandemic, but then also how these influenced people's attitudes and behaviors. Thank you.
Wonderful, thank you, Ashley. And if you want to use the chat to go ahead and start submitting questions ahead of time for a particular poster while other students present, by all means. Next up, we have Michaela. Michaela, you there?
I am.
All right.
Thank you, Natalie.
The floor is yours.
Thank you. Hi, everyone. So my name is Michaela Camer. I'm a graduate student studying agricultural communications at the University of Florida. And what I'm presenting to you today is a small piece of my thesis research for my graduate program. And so this is the first time I get to present this information, so I'm super excited to share it with all of you today. The title of my study is Public Perceptions of Food Purchasing Habits and Food Safety Behaviors as They Relate to the COVID-19 Pandemic. The purpose of my study was to describe Americans' food purchasing habits and food safety behaviors as they relate to the COVID-19 pandemic. For this study, a quantitative survey was conducted with approximately 1,500 residents in the United States to address the purpose. I used quota sampling to obtain a sample that was representative of the US population based on income, ethnicity, gender, and socioeconomic status. The data for this study was collected between July 24th, 2020 and August 8th, 2020 using a third-party recruiting company called Qualtrics. A researcher-developed questionnaire was used to assess food purchasing habits and food safety behaviors as they relate to the COVID-19 pandemic. And in the survey, respondents were asked to indicate the degree to which statements were true of them or not true of them using a 5-point Likert type scale, with 1 representing not at all true of me and 5 representing extremely true of me. Respondents were specifically asked about their food purchasing habits and food safety behaviors before, during, and after COVID-19. And descriptive data analysis were conducted using SPSS. This study was also a smaller part of a larger study that explored the perceptions of COVID-19 and the third iteration of this survey conducted by the Center for Public Issues Education and Agriculture and Natural Resources, or the PI Center. Preliminary data analysis indicated that 86% of respondents experienced an increase in food prices due to the COVID-19 pandemic. 77% of respondents also indicated that in the past month they have looked for information related to food safety. And due to COVID-19, 75% of respondents reported having some level of concern about food safety. 72% of respondents reported that they have purchased local foods in the past month due to COVID-19. Additionally, respondents were asked about their food safety behaviors in the past month due to COVID-19. And for this, respondents were given 4 statements about food safety. They were asked, their statements were about washing their hands before preparing food, washing their hands before consuming food, making sure their fruits and vegetables are rinsed before they were eating them, and then washing their fruits and vegetables with soap, bleach, sanitizer, alcohol, or disinfectant. After each statement, respondents were asked to identify how true or untrue each statement was of them on the Likert type scale that I mentioned earlier. And these statements were derived from the CDC's website and list of recommendations for food safety. It's important to note that the CDC recommends that you do not wash your fruits and vegetables with soap, bleach, sanitizer, alcohol, or disinfectants. So overall, respondents indicated that in the past month, they had followed the recommended CDC guidelines related to food safety, as 93.7% responded that they had washed their hands before preparing food, 93.2% responded that they had washed their hands before consuming food, and 90% responding that they made sure their fruits and vegetables are rinsed before eating them, and then only 47.1% responded that they had washed their fruits and vegetables with soap, bleach, sanitizer, alcohol, or disinfectant, which again is one of the steps that isn't recommended by the CDC. And then lastly, respondents were also asked about their preferences when purchasing local food during COVID-19. Respondents were given 7 characteristics of local food, which were derived previously from PI Center research. In the list of 7 characteristics, respondents indicated that when purchasing local foods, price and savor for their families were at the highest priority, and these percentages represent the number of respondents who ranked each option first in order of importance. So 33.8% said that price was the number 1 important characteristic. 27.1% responded that savor for their family was the number 1 important characteristic. 13.4% responded that freshness was the most important. 9% responded that availability was the most important. 5.9% responded that supporting the local economy was important. 5.7% responded that taste was the most important. And then lastly, 5.1% responded that convenience was the most important. This preliminary research suggests that respondents' food purchasing habits and food safety behaviors were impacted by COVID-19, and this research aims to address and inform the lack of knowledge on how to communicate messages related to food purchasing habits and food safety behaviors during health-related crises. Thanks.
Awesome. Thank you, Michaela. All right, so next up we've got Christine. Are you there?
Yes, I am.
All right, Christine, the floor is yours.
All right, thank you. My name is Christine Kelly-Begazo. I'm an extension agent and county director in Indian River County. And I did a survey to discover safety measures for fresh fruit agriculture workers and their training needs. And the reason I did this survey was because in March, I actually came down with COVID myself, quite a severe case of it. And after I was recovering, I was very much concerned about agricultural workers, just knowing the extent of the spread and how quickly it can happen through close working participants. And also during the fall season, we train about 1,000 plus agricultural workers in the fresh fruit citrus industry on the Treasure Coast. And so how the companies were going to adapt to COVID and in keeping their workers safe was very important to me. And also I wanted to see what kind of training needs that they were going to need from us in addition to the training that we already do for them. So I created a 10-question survey and sent it out mainly just to the companies that we work with on the Treasure Coast, but it got picked up statewide and through a couple of different venues. And so I got back a lot more questionnaires than I had originally expected, which is of course perfectly fine, but it gave some interesting results for that. One of the questions was, how concerned are you about COVID at your place of work? And of course, this questionnaire went to managers, supervisors, producers, and owners. And about 50% were extremely concerned, but I was very curious to see that in June, still June through July in which this ran, 25% were still slightly concerned or not very concerned at all. And so that led me to believe that some people within this industry were not taking it as seriously as they needed to. Then I asked a series of questions about employees being tested for COVID and having COVID, and 62% at the time in which they took this survey said that they had not had anyone test for COVID at the time. I'm sure in another month or two, if I rerun this survey, I'm sure I'll see quite a bit of a difference. One of the questions I asked them was that if someone had felt they had COVID, why didn't they get tested? And not very surprising, 27% said that it was due to a lack of available tests. An interesting component was also too, about 11% responded saying that the workers were afraid to get tested. And another 15% responded by saying that most of the workers didn't know where to get tested. So I felt that was some very interesting information. One of the other questions was what measures had they instituted in their place of work to prevent the spread. Of course, the results came out pretty much what we'd expect them to do. Almost 24% said that they were making hand sanitizer more available. 20% said that they were requiring masks. One thing that I felt that was interesting, that was less than 10% were saying that they were instituting temperature checks as the workers came back. So that was kind of interesting to me. I also asked for some of the examples of measures that they were putting into place, but that I didn't specifically have as one of my choices. Most of it was only 2 to a vehicle, minimal meetings with outsiders, different lunch times for different crews. So different companies were making different arrangements. One company that I felt was very interesting, they were going to have mandatory medical evaluations for people that call in sick. And then they were going to pay for COVID medical testing and evaluation. So I thought that was very proactive. Another company was building individual workstations with plexiglass, which I'd like to see that myself, because in a packing house that might be very challenging. So I did ask for when workers return in the fall, which of course for us, fresh fruit, that's for citrus, that begins in the fall and goes through the winter time. I asked them what safety measures were they anticipating to put into place. Of course, social distancing was one of those, but I find that to be over 60% said that social distancing would be required. I found that to be a little challenging, especially with how the citrus workers do work, but many were going to have additional hand washing stations. Some were going to have temperature checks. The majority were going to require that workers wear masks. So then I asked what kind of additional information that they would need or tools. Many wanted their contact information with the Department of Health in order to get free masks. And then I also asked them if they'd like UF IFAS extension to come and train some of their workers. The majority of them said that they were going to give out educational information and increase workshops for the workers, but only about 20% answered that yes, they would like to have someone come out and talk to their workers about COVID. So I found some of this information interesting, not only on the aspect of how these producers were going to make some changes to keep their workers safe, but also to incorporate some of this information into our own training program, not only to keep our staff safe, our training staff, but also to make sure that all the workers understood the risks with COVID and the way in which that they could prevent the spread. So I'm thinking about reissuing this survey again in another couple of months, just to see if those some of those changes were made, and also to see if some of their opinions and perspectives on the questions were changed as well.
Wonderful, Christine. Thank you so much for sharing that. All right, so next up we have Valentina. Are you there?
Hi, yes, I'm here.
All right, the floor is yours, Valentina.
All right, thank you, Natalie. Hello, everyone. My name is Valentina. I'm a graduate student at the University of Florida studying agricultural communications, and I'm really excited to bring this poster here to you today. So to start with the purpose, the main purpose of this poster and this research was to understand the public's perception surrounding the impact of COVID-19 on race and cultural issues in the United States. So back in January, we had, the United States had the first confirmed case of COVID-19. And we know that during a pandemic, we typically see anxiety increase in a population as the number of positive cases rise. And specifically with COVID-19, we've seen a significant increase in anxiety due to financial worry surrounding the pandemic. So in addition to these typical stressors that we have, during this time, the United States also experienced several high-profile and controversial events during this time. So these events led to widespread protests throughout the country, and at the same time, we were experiencing a significant increase in positive cases. So going back to the purpose of this research, we really wanted to understand how Americans felt about the impact of COVID-19 on race and cultural relations in the US with all these additional stressors. So in order to do this, we conducted a public opinion survey through Qualtrics from July 23rd through August 9th, just to give you kind of an idea of where we were at that time. And it was with a quota sample representative of the US Census. And we did have about 1,500, I'm sorry, not about, we had 1,500 participants complete the survey. And the survey was also part of a larger study regarding cultural implications of COVID-19. And so for the results, we found that, yes, Americans are concerned about the impact of COVID-19 on race and cultural issues in the United States. We had 58% of Americans who reported concern that COVID-19 is making it harder for underrepresented groups to achieve the American dream. 56% of Americans are concerned that COVID-19 has created a cultural divide in the United States. And 55% of Americans reported being concerned that COVID-19 has made race and cultural relations worse in this country. So where do we go from here? So now that we know that Americans are concerned about this, what we really need to do is implement further research to better understand how a global health crisis like a pandemic can impact underrepresented populations in the United States. And also further research should address how communicators can better discuss and present this information regarding the impact of global health crisis on underrepresented and marginalized communities in the country. And that's all I have for you. Thank you.
Excellent. Thank you, Valentina. All right. I think next we have Dr. Shelly Rampold. Dr. Rampold, are you there?
I'm here. Can you hear me?
All right. Yes, I hear you perfectly. The floor is yours.
Awesome. So today I'm going to be presenting on a piece of our research within the same type of studies that you've heard everyone else, well, at least, the other four talk about. We know that from watching the news or getting on social media that even though we don't have a COVID-19 vaccine, that we've already received a lot of attention from it. And there's a good chance that a large number of Americans won't get this vaccine should it become available. And that may be due to affordability or access issues. But there's another chance that it would be due to mistrust in the manufacturers of the vaccine and the regulatory agencies and the politicians speaking about the vaccine. And so we wanted to get some preliminary research to better understand who would and would not get the COVID vaccine. So we collected this study with a national sample. I saw it in the questions that someone had a question from Michaela about the sample and how they were recruited. So we used a third-party survey company, and they used what's called a non-probability opt-in sample. And this will be the same for Ashley's paper, Valentina's, Michaela's. It's the same, it's the same approach. So what they do is they recruit through web platforms, through prepaid panel groups, through social media, and they also contact other recruiting companies that they partner with. And then they set quotas and they obtain a sample for us that's representative of the US population. And then in some cases, we'll weight the data based on the 2010 census to make sure that people based on gender and race are represented. So that's what we did for everyone's study. I figured I'd go ahead and answer that question now. So we found some positive results. I know the people who say they won't get the vaccine think they're the silent minority. However, they are, the silent majority, they're actually the silent minority, because we found that 80% of people would get a COVID vaccine should one become available. And then we looked at some of the differences between those groups and saw that people who would get the vaccine were those who get a flu shot regularly, get other recommended vaccinations, get their children vaccinated, or would get their children vaccinated if they had children, have more positive attitudes toward vaccines in general. And then we had there are a few more in the would get group who had been diagnosed with COVID or had known someone who had been diagnosed with COVID. So that kind of speaks to personal relevance and the importance of vaccines. So then we conducted binary logistic regression to look at the predictive ability of some of these variables on the willingness group. So those were coded willing and not willing. And interestingly, we found that the strongest predictor was their prior vaccine attitude. So at the early stages in the pandemic, people's prior vaccine behaviors are what's going to be most predictive of their likeliness of getting the COVID vaccine. General attitudes in science and vaccines were also significant predictors of whether they would or would not get the vaccine. And then their overall degree of concern. So the more concerned they were about their health, their loved one's health, the more likely they would be to fall in the category of those who would get the vaccine. What we found though was that trust in science was not a significant predictor of whether or not they would or would not get the COVID vaccine. And when we were discussing this, we were thinking, this was conducted in March in the early stages of the pandemic, right? Before it had been quite as politicized, before there was time to discuss microchipping in the vaccine. There wasn't enough time for public distrust, I think, in this to have surfaced. So it'd be really beneficial to go ahead and do this again now that there's been more time for people to talk about different issues or concerns with a COVID-19 vaccine. So that's our plan moving forward. This was just kind of a preliminary analysis to help us figure out the best method of examining public perceptions about these vaccines. And so moving forward, we'd like to do this again at a later stage to see how public trust in science has changed.
Wonderful. Thank you, Dr. Rampold. And last but not least, we've got Beatrice. Beatrice, are you there?
Yes, I am.
All right, Beatrice, the floor is yours.
All right, thank you. Can you see me?
Yes.
Okay, thank you. Good afternoon, everyone. Thank you for this opportunity to share with you the preliminary results of a study, a big study that Dr. Irani and myself and I have undertaken. It has been a year. I should say that Dr. Irani and we are working on health and safety, agricultural health and safety. And so we wanted to assess the agricultural stakeholders' perceptions about health and safety so we could adjust our interventions. In the meantime, the pandemic hit, and that caused a delay in the process. And at the same time, we acknowledge that both rural and urban areas were impacted health-wise by COVID. Therefore, we decided to add, to incorporate into the study a COVID component. Overall, we wanted to assess the agricultural stakeholders' perception about the pandemic, and also from a health and safety standpoint. And also we wanted to identify any barriers to implementing the CDC guidelines requirement. And third, we wanted to come up with any potential alternatives for the implementation of such guidelines. For that reason, we interviewed 11 people. They have sound experience in the industry. These people included extension agents, growers, farm labor contractors, worker safety representatives. The interviews led to, I can say, rich findings, but for the sake of this session, I will only talk about the barriers and the potential impact of COVID on future business model. From the barriers side, what we noticed is that barriers are contingent to the size of the business, the type of operations, and the intensity of labor force. But beside that, there are common points, as I would say, common barriers, no matter the size of the business. Among them, we have culture, and the second one is cost factors. As Dr. Morris this morning in his presentation highlighted, the main barriers for cost factors are transportation and housing, if we really need to respect the distancing, as required by CDC, especially when it comes to the H2A workers. And cost also on the size of the workers, because for the mask, sometimes if they don't have enough or the employer do not provide enough, so they have to buy it, and on average it's about $1 each. Now and also there is another barrier that there are many in the poster, but this one I would like to highlight it, is the flaw inherent to the CDC guidelines. They are regulations, they are not laws, so it's kind of hard to enforce them. Now talking about the potential impact that COVID may have on future business model, the respondent realized that, despite the traumatizing effect of COVID-19, it offers what I would call an unprecedented opportunities to the company to do business differently and more efficiently. They highlighted some novelties that we may see in the industry coming, in the near future. For example, big companies may end up using technology more than we might think of in order to do distance learning, marketing, and sales as well. And I remember this quote, one of the participants said that virtual meetings may become a staple. The second element that I would like to highlight here is that relates to the H2A workers. Some companies may end up implementing H2A programs because they realize that they need to improve their labor force. And the last one, which I think is really key there, is the possibility for us to observe new re-engineering in the agricultural industry, especially when it comes to designing of new tools and equipment. This, to conclude, I would say that these preliminary results or findings help us discover the unique opportunity that the pandemic offers to training providers, extension specialists to revamp their services and to adapt their approach as well. And the result also stressed the urgency to start conversing with growers using either local radio stations, community leaders, social network, etc., as the fall season is around the corner. I truly hope that these findings can help agricultural stakeholders, including advocacy groups, growers, farm labor contractors, and you name it, to shape their health and safety plans and strategies to find the best way possible to face and combat this challenging plague. Thank you very much, and I'm open for any question. Thank you.
Thank you, Beatrice. And now we have Dr. Angie Lindsey, who's going to be our moderator for any questions. So go ahead and submit those in the chat box for any of our poster presenters.
Great, thanks, Natalie. Hi, everyone. Thanks for joining us this afternoon. As Natalie said, my name is Angie Lindsey, and I'm a team member with the center. So I'm very excited to help moderate the question and answer period here today. And as Natalie said, if you have a question that comes up while we're discussing something, please put it in the chat, and I will try to get it to the right person. So there's a couple that are already in there. Thank you, Vanessa, for some great questions. It looks like that Dr. Rampold actually answered the first part of the question for Michaela, but there was two other questions here from Michaela regarding if the data that you collected indicated whether the respondents were outside of a food desert, and also did they indicate what sources of food business they had access to, for instance, supermarkets, fresh markets, I imagine open air markets as well. So Michaela?
Hey, thanks for the question, Vanessa. That was actually outside the scope of my research, but that is definitely something that we could include in future iterations and try to find out more about.
Great, thanks, Michaela. And the next question is for Christine, and I actually had the same question. So Christine, did you find a willingness or resistance towards online training for some of the ag operations regarding the COVID-19 safety?
I wouldn't necessarily say that because our training is required for their third-party audits. So we do a series through the whole day that covers WPS, food safety, personal hygiene. It's done in English and in Spanish. So the producers need this for the third-party audit, so we didn't see much resistance. I think more of the resistance came from my end of it, because now we have to do everything via Zoom, and it's extremely difficult. I'm usually used to teaching in front of 100 and 150 workers in Spanish, and translating that to an online format is very challenging. Since we at UF-IFAS are limited to the number of people that we can talk in front of. So it's probably going to actually be easier for the producers to have these videos, because then they don't have to schedule around our time or Dr. Reitnauer, who's my counterpart in this. So no, I didn't see that, but it's not specifically COVID training. The COVID information is being incorporated into the personal health and food safety presentations. And a lot of the third-party auditors aren't asking for that training. So it's coming from the buyer side as opposed to the producer side.
Great, thanks, Christine. Next question is for Valentina. Valentina, did you consider language in different languages as a variable in your research as well?
Hi, thanks for your question, Vanessa. So for this survey, we did not consider language. But that is a great question, and that's definitely something that should be considered as future research is done on this topic.
Great, thanks, Valentina. And Christine, there's another question that just came in for you as well. Based on the data you collected, what worries you the most for the upcoming season regarding preventing or mitigating COVID-19 among farm workers?
Oh, that's a big one. I have a couple of different worries. I've been working with this audience for about 15 to 18 years now, and I know we're working not only with the producers, but also with the workers. And the workers, there's some cultural aspects that prevent them from incorporating some of the suggestions that we give them. But also on the producer side, we have some challenges. And one of the challenges that I saw that's quite evident in some of the visits that I've made, that I've been able to do during the pandemic, is that some of the producers say, well, they won't wear masks, but the producer wasn't wearing a mask either. And so I think that the example is set. I was wearing my mask. Even though we were outside, we were in an open air packing house. I feel that that example needs to be set. And if the producer or the supervisor or the owner of the company themselves don't set the proper example, then the workers aren't going to either. So those two things, the cultural barriers as well as the producer example themselves, are things that really concern me.
Great, thank you, Christine. So I actually had a question for Ashley. Ashley, on your poster, it indicated the exchange relationship was actually low. Given what you were talking about regarding, respect and maybe some past behavior, do you think that this would be higher in the future, in future pandemics, I dare say, because of their visibility and the of the CDC right now?
Yeah, thanks for the question, Angie. I do think that obviously, as terrible as this situation is for everyone, that the CDC has had some incredible opportunities throughout this pandemic to be able to reach different communities and different populations that they might not have had the opportunity to otherwise. I know that the CDC has even been working with extension groups throughout the state where that opportunity might not have presented itself in the past. So I think that they're definitely having the opportunity to build those relationships now so that in the future, people are going to be able to look back on past experiences and hopefully have favorable memories and to continue to build a stronger relationship in the future. So absolutely.
Great, thank you very much. And Beatrice, I'm not going to leave you out. I actually have a question for you as well. You talked to a lot of different types of folks. I know you had extension agents in there, and then you had some representatives from different types of industries, including forestry and Florida fruit and vegetables as well. Did you find that the barriers differed based upon the different types of industry, or were most of the barriers kind of across all of the interviews that you did?
I would say there are specific barriers, such as, for example, forestry and ag. There is a difference because, the crops are not the same. So it is more difficult for the specialty crops than the other crops. But, in terms of culture, it was across the board. And one example about, in some culture, males wearing masks, look strange. This is the type of example that we get. And they are used to the bandana thing, so they won't switch that easily. And yeah, to answer your question, there's a lot of difference. But for housing and transportation, it is actually forestry. They kind of better off, I would say. Because it's easier, the type of job, because the issue for distancing in the forestry is more in the mill, because, in the field, it's not that difficult at all, but in the mill, and they find a way to manage that. Yeah.
Great, thank you, very interesting. Okay, so we have a few more minutes. If you had a question to come in the chat box, we'll take it now. Otherwise, I will turn it back over to you, Natalie. So thank you all very much. Thank you very much to some great poster presentations. So a round of applause. Thank you.
Thank you.
Great job, everybody. Well, I know you have all heard or seen me throughout the day. I am Natalie Santamaria. I'm the Outreach Coordinator for the Southeastern Coastal Center for Agricultural Health and Safety. Please take a moment to fill out the Day 1 event feedback survey that I just linked on the chat before you sign off today. I want to thank everyone for participating in Day 1 of our State of the Science meeting. I also want to extend my sincere gratitude and my team's gratitude to all the presenters and moderators who shared their knowledge and time today, not to mention the Outreach Core teammates who are behind the scenes helping make this happen. Thank you very much. We hope that you will join us on next Friday, September 18th. For Day 2 of the meeting, there are 4 remaining sessions, and we'll cover communicating resources, sterilization and fit testing for personal protective equipment, economic implications on agricultural businesses, as well as a roundtable discussion very similar to this on the impact of COVID-19 on extension agents. So many of the sessions from this year's State of the Science meeting, today's and next week's, will evolve into in-depth 1-hour webinars throughout 2021. So please connect with us on social media or via our Ag Center mailing list to stay up to date on all our future events. So when you get to the end of the survey, you will see our subscription option to our mailing list, so you don't have to go look for it. We made it pretty easy for you to join our team. So this concludes our program for today. Thank you all for joining. I think we had one last question come in, Angie, from Russell. We'll go ahead and answer that one.
We did, sure.
All right.
Thank you, Russell. Michaela, it was directed to you regarding, do you feel the survey adequately reached a representative cross-section of the U.S. SCS demographics? And then the follow-up, do you feel similar future surveys should possibly be weighted by the density of respondents in each of the SCS groups?
Hi, Russell. Thanks again for the question. I do feel like that it did adequately reach the representative cross-section of the U.S. And the data I presented today is just preliminary and descriptive statistics, but moving forward, I do plan to do some weighting and dig deeper into the data.
Great. Thank you, Michaela. Thank you, Russell, for a great question also.
Yeah. Awesome. Well, this concludes our program for today. Thank you all for joining, and we hope to see you next Friday.
All right. Thank you.